In choosing people to watch in 2018, we wanted to profile individuals who have the power and position to touch our lives, but also bring a hint of the unknown. Healthcare is one of the largest drivers of the economy in Southwest Florida. With 5 hospitals, along with dozens of outpatient centers and specialty practices, Lee Health has a huge stake in the area's healthcare. Going into the new year, the system is stretching its reach both north and south, guided by a new CEO leading a business founded in sickness and in health. Now, we selected you as one of our persons to watch for 2018 because of the new role you assumed. Actually, you've had it now for several months now.
Yeah, June 1st is when I became president and CEO.
People may not be aware that you've been around and part of the health system, so you're not a new hire coming into the area. You have history with them. What were your roles working up to this?
Well, I actually came here in 1983 as a practicing obstetrician gynecologist, and I practiced for 24 years. And I built a primary care group with a number of other physicians called Physicians Primary Care, and I ran that for about 10 years before coming full-time with the health system in 2007. So in 2007, I became the Chief Administrative Officer of Cape Coral Hospital, and then from there I've moved on and was Chief Operating Officer for the system for a number of years before assuming the CEO President's role.
And in the last couple of years, everyone has noticed the phenomenal growth that Lee Health has undergone. Do you see that as continuing, or is that kind of just filling out now what we have?
Well, I think the growth has really mirrored the growth of the population. And we anticipate that that population will continue to grow at 2.5% a year for the foreseeable future. So we will continue to grow to meet the needs of the community.
And can you kind of discuss the size and scope of Lee Health currently?
Yeah, Lee Health is the 5th largest public health system in the country right now. And what's unique about us is that we don't receive tax support. So we rely completely on patient revenue to pay our bills and to take care of the future needs of the organization. We have 4 acute care hospitals. We have a children's hospital and a rehab hospital, along with a multitude of outpatient facilities, home health agency, a skilled nursing unit. So we really have the complete gamut of healthcare in the community.
How important are some of these other locations? Because I think you and I discussed at one point how hospitals now seem to be the sickest of the sick stay in, because if they can, most people want to be able to go home.
Right.
So is it important to offer these services throughout the area, the region?
It really is. We're seeing a move from inpatient to outpatient care. We really believe that in the future, the majority of care will be delivered in the outpatient setting or even the home. So it's very important that we have these facilities out and around the community.
And what do you think is an area that you would target for growth or services to a certain maybe demographic or population? We just have the Children's Hospital targeting those services, but do you see another area that you think that Lee Health is going to be kind of looking at with importance?
Absolutely. The Children's Hospital, as you mentioned, is the only children's hospital between Tampa and Miami, so there's a tremendous need for those type of services. On the adult side, there's a big focus on South Lee County. We anticipate that 30% of the Lee County population will live in that area. And for a long time, they've been asking for services, and we're going to be providing that in the very near future.
Can you talk about the new facility that recently broke ground?
Absolutely. We bought land down in South Lee County many years ago with the anticipation that someday we'd build a hospital there. We actually applied for a certificate of need that was turned down by the state. So what we're doing is we're building a very large facility that's going to be primarily outpatient, but it will include a 24-hour emergency room. So there'll be an emergency room there. There'll be what we call a clinical decision area for people that need to stick around for a while for observation. We'll have a surgery center, imaging, therapies, and physician offices. So it will be basically a hospital without hospital beds, is what we're referring to.
And I've always heard it said, but never directly from someone's mouth, that there's the potential then maybe to make it, if the tides change in future years, to make that a full-service hospital?
That's right. We're building it structurally so that it could, we could add a bed tower in the future if that became a possibility.
If you get the South area covered, and you certainly have Central and North Lee County covered, do you keep going across county lines then? I've heard that there's something in Babcock Ranch that you're providing some medical services there, which is probably in Charlotte County.
Yeah, we predominantly focus on Lee County, except for what we call regional services, such as trauma and children, for instance. Babcock was a unique opportunity because Babcock is an actual separate governmental entity, and part of it is in Lee County. So we're working with them right now to provide some services at their wellness facility and also in the area of primary care.
So if we look past like new facilities and things, what are the challenges currently facing the ones you have? I know that health grades will be coming out very shortly here, and that's been a constant area of concern, how to bring up those grades.
Right. Well, one of the things that we've done is when I became CEO, I really wanted to focus our strategy on 4 specific things. I think that it's important that you show a vision for your strategy and a vision that everyone can understand, from a housekeeper to a heart surgeon. So we reduced the strategic initiatives down to 4, and that's excellent patient experience, excellent patient care and outcomes, financial viability, and coordinated care. So that's really what we're focusing on, and we're building teams around that. We've changed our structure. We've added physician leadership at each campus to engage our physicians, because we realize none of these things can be achieved without our partnership with our physicians. And so we're really trying to change the way care is delivered in this community, and to raise that bar on quality and to lower the cost.
In a lot of business sectors, there are people that are there run because they run businesses, and some that come kind of organically from within the business.
Yes.
Do you think it makes a difference that you are a physician running a health system?
I think it makes a difference for a lot of reasons. Number one, not only am I a physician, but I'm a physician who practiced here. And as a result, I've worked side by side with many of the physicians on the medical staff. So there's been a certain trust that's been built up over these many decades. And I think it really helps as I go and I work with the physicians to try to change the metrics that we're trying to change with regard to improving quality and lowering costs. So I do think it makes a difference, and I think it just accelerates the change that we can undergo.
Since you bring the physician perspective in a little bit, you carry that with you. I've seen reports that when they look at health systems of how top-heavy some are with administration, poor, as opposed to the caregivers.
Right.
Do you think that's a concern when you have a physician that studied for 17 years and to be a very specialty practice? You know, the question then their value to the overall system and their level of contribution?
Well, certainly there's a difference in qualities of being a physician versus being a leader sometimes, and you need to pick the right physicians. And we have many physicians in leadership positions in the system that understand what it means to be a leader, and we can see it. It's making a difference.
In 2018, what do you think the biggest initiative is going to be? I know you're relocating the trauma center, building out the new area in Estero. What do you think is going to be maybe the biggest focus, or something we might see as an accomplishment at the end of 2018?
I think one of the biggest new things that we're going to see is this move from volume to value. And what that means is it's changing the delivery system. And in other words, we're working right now with Medicare to take a subgroup of patients, and rather than be reimbursed on a fee-for-service basis, in other words, by how many things we do and how many patients are in the hospital, be reimbursed based on taking care of that population completely and being at risk for that population. And I think what that will do, it'll create all sorts of new delivery systems and new technologies that will allow us to do that. Because now we're going to be completely focused on how do we keep those patients healthy? How do we keep them out of the hospital? How do we keep them at home? And that's good for patients, it's good for the payers, and it could be good for the health system too.
That kind of reminds me of the move towards preventative care and
Right.
maintenance. Do you think that could be affected at all by what happens in Washington and what happens with healthcare and insurance and things like that?
Yeah, certainly we watch those things very, very carefully, but because of what happens in Washington can be so variable and so unpredictable, we have to focus on what we can control. And then what we have to do then is react to what happens in Washington or in Tallahassee. We're very concerned about Medicaid reimbursement. We've been seeing cuts in Medicaid reimbursement that affect the most vulnerable of our patients year over year. So we're trying very hard during this legislative session to deliver that message that we need to support the safety net hospitals like ours that take care of these patients.
I've heard that the Children's Hospital is a very large safety net because, not that you would deny care anywhere, but particularly with children, that is probably an area that you don't get as many reimbursements. Is that correct?
That's absolutely true. If you look at our reimbursement across the adult world, about 25% roughly would be Medicaid. And Medicaid is the lowest payer of all payers. On the children's side, about 70% of the children in the children's hospital are covered by Medicaid. So it's very, very difficult to provide the type of care and the acuity of care that these kids need under that reimbursement scheme. That's why philanthropy is so important with Children's Hospital, and why this hospital will never have been built without the support and the generosity of this community.
And so obviously it's very important to be able to deliver those services. And in addition, I know that Lee Health has invested heavily in a lot of the technologies and diagnostic tools and some of those platforms. Do you think that really is a value add for the people in Southwest Florida? Without
a doubt. And the technology that we've developed here and have acquired here has really been top notch. And if you get a chance to tour the Children's Hospital, you'll see amazing things. And it's not only the technology though, it's the people. The things that we see in a children's hospital are very different than what we would see at a hospital that takes care of children. Because many hospitals will have units that take care of kids, but there are things that we do here, such as having full-time teachers that can come in and teach children if they miss school. Absolutely. There are specialists called child life specialists whose only job is the comfort of our kids, to help them through whether it's a test or a treatment. And they have very unique ways to do that, to distract children as they're getting an MRI or a CAT scan or an IV or whatever they might need. So these are the types of things that you'll see in true children's hospitals that just don't happen in other places.
Now, I know for the past several years you have been up in top leadership within the health system anyway, but now that it's transitioned to where these are your decisions, do you see them going in a different direction that you have maybe championed before? You know, what's going to be the difference maybe before how Jim Nathan ran it and how Larry Antonucci runs it?
Yeah, I think that's really going to be driven by what's happening in the marketplace. I think that this move from volume to value is going to really change the delivery system, and it's not necessarily what Larry Antonucci wants, but it's what patients want and what patients deserve and what payers want. So I think we're going to see a different type of healthcare system, but it's really driven by outside forces.